go to each group and just take a little bit of feedback, however brief that may be. That's absolutely fine. It's not always easy to capture a quarter of an hour conversation and feed it back completely, but hopefully it did give you a chance to share some ideas with each other. I don't think we've got any background noise or anything, but if you're not speaking, perhaps if you could just pop yourself on mute, because we will have a couple of people unmuted, so that would be really helpful. Thank you. Okay, so could I go first of all to room 1, please? I think it's Helen.
It is. So we had a mixture of people who, some have used it, some are just beginning to be SENCO, so they haven't had any knowledge of it. Well, they know about it, that's it, but they haven't actually looked at it. So we had quite a good discussion. We had Sarah and Annetta. You've used it quite a bit, haven't you? Sarah, could you tell me about how you said you felt you could use, some people could use it independently?
I think I was trying to explain that a lot of us that are slightly maturer have had the previous SENCO training. We've had all the processes that were really beneficial, but we would feel confident in passing that down to our less experienced practitioners to work through the process themselves, where they'd be able to take into account what had the same level of learning just by following the processes within the guidance of it. And we felt that a hard copy in the setting would be really beneficial for more of our students, so that they could look through the processes and support their learning, but as well as understanding the routines that we have in the nursery already.
Thanks, Sarah. One of the other things, Jenny, that came out was around that perhaps a lot of the settings with COVID haven't had staff meetings, and they felt that they could embed the approaches within it through that. And I said, well, you'd have to do it on a gradual thing, because you wouldn't want to look at the whole thing together. So they thought they could share knowledge, they thought they could reflect on it. So yes, I think it was positive. So some obviously used it more than others, but the ones that had used it thought it was a really good document.
Oh, that's great. Thank you, Helen. And like I said at the beginning, we're all going to be in different places. We've all had so many different circumstances to deal with over the last year and a half, haven't we? And we're always in different places anyway, but it's great for you to help each other and think about, that setting that just spoke out. Thank you very much, because you've shown that actually it is a really usable tool. So you're recommending it very highly to others of us who are joining this afternoon. Thank you. And then we've got room 2, Mel O'Leary.
Yes, good afternoon. Steve from the Plymouth Nursery School Federation very kindly shared the provision mapping that they've done, cross-referencing to the graduated approach. So they've started to think, well, that they've thought about what's on offer, universal, targeted and specialist. And we talked about how the tool can be referred to in an ongoing way, and you might identify gaps and add to what you're already offering. But Steve, do you want to add anything more about your provision map? I don't know if Steve's there.
I am still here, yeah, Mel. No, I think you've covered it quite well there. We're just looking at saying that we're really at the beginning of the journey of using the document, I suppose, in terms of particularly as a bit of a resource bank. So we're, I think some of us are aware of it, but we're kind of looking at how we can use it. And part of that process, I looked at putting together kind of a provision map in terms of what we offer now as a kind of a federation within the federation universally. So what is our universal offer for all our children in our setting? And then we kind of mapped kind of what our targeted approaches are. So things like our blast groups and things like that. And really have just put it down on the provision map. So what we offer now, and we were talking about how that will probably evolve as we use that document and kind of, I suppose, gain an awareness of other things that we could be using or trying as well to support these children who have kind of particular areas of need.
Thanks, Steve.
I'll turn my camera off again.
Thank you. That's really useful feedback. Thank you, Mel. Okay, and we've got room 3. So I believe this was Suzanne James, your group.
Yes. Hello.
Hi.
So we had people who started using it in their setting, to look at the support they've got in place for individual children, and settings that had shared it with staff at staff meeting, and settings that were planning to use it. There was some concerns that it can seem overwhelming when you look at it. There's a lot to sort of take in, and we were discussing sort of different ways of how to use it, and it's interesting hearing those different ways, because we don't want to sort of dictate this is, you know, how to use it. And you know, if you're trying to use it as a tick list, it can seem, you know, quite large and quite overwhelming, and we didn't want it to be a barrier for getting in that timely support and intervention for children. Especially if you're want to go down that route of asking for more help. But it was about, how do you know that you've gone through that graduated approach to, you know, you've got that universal provision in place, you reflected on that, you know that you've thought about how you know that universal provision is in place, you've put in that targeted support. Maybe the child isn't still making progress, but how you then perhaps evidence that if you're putting in a request for help, what that might look like, and that you know, we don't want to make the paperwork too burdensome for settings or for SENCOs who you know, haven't got very much time, but I thought that this meeting was very useful to sort of share sort of ideas around that, about how people are showing that they have gone through the graduated approach, but that they are using it in a sort of smart way to support their requests for more help, rather than it being a barrier for children to get that support when they need. We're also talking about the time that it takes to go through sort of those different stages, and I said it sort of depends for each individual child.
Thank you. And we're going to talk about, you know, keeping paperwork manageable in a minute. So that leads us into our conversation a bit later on. So thank you, Suzanne. And then we've got room 4. I think this was Jane and Sarah together. Should I come to you, Jane? You're on my screen, but Sarah, please chip in as well.
Oh,
you're on mute, Jane. You might have to talk, Sarah.
No, she'll sort it. Are you unmuted?
Yeah, no, sorry. Yeah, that had
There's
to
always
be one,
one.
didn't
There's
there?
always one. We can't get through a meeting without it, so we've done now. So hopefully that's no more muting. Thanks,
Yeah.
Jane.
So the settings that we had with us, unfortunately, it had quite a lot of issues with COVID, and hadn't actually been using the document yet. I know Lisa and Dawn, they've been using it. Curious Kittens, they've been looking at it, although they haven't actually used it as such. They're not having staff meetings as such due to childcare issues and things at the moment. But they were saying that, having looked through the document, it's a really useful document, but they've noticed that a lot of it is the good practice that they use already. Which I hope everybody has found, because it should be the things that we've all been. I know me and Helen, I said to Dawn, you know, we are always banging on about those sorts of things anyway. So I think it is overwhelming to look at, but when you start to go through and look at all the details in it, there will be loads there that you already do that is already good practice. So we did suggest, didn't we, Sarah, that perhaps in September, when some of the staff meetings start to happen again, that everyone goes through and maybe devotes some time each staff meeting just to sort of have a look at the sections and just reflect on, what do we already do? What could we pick up on now that we don't do?
Yeah.
Have I covered everything, Sarah?
Yeah, I think so. Yeah.
That's great here, isn't it? And that's what, like you said, Jane, we hoped that, you know, all that's in there is good practice, isn't it? And if you're doing lots of those things, that's great. But it's a good tool, isn't it, to refer back to and see if there's anything else that you need to do before you request that additional support or additional help. Thank you.
We were just saying things like, sometimes you get a little, not stuck in your way, but you tend to do things a certain way, and you haven't had a child with a certain specific disability for a long time, and that's when you then would look at the document and then think, oh, of course we could do that. We did that years ago. At the back of my cupboard somewhere, I've still got the resources. So
exactly.
hopefully it would be a good, you know, not a checklist, but a thing to make you think, could do that.
Yes, good resource for us to be using. Thank you. And then we've got room 5 last of all. I believe it's Lisa. Welcome, Lisa.
Hi everybody. Well, that was lucky. I've just looked back on. I dropped off, so unfortunately I missed half of Suzanne, and I missed room 4 as well. Sorry, Jane, but I'm back.
You've got the recording.
So,
you can go back to the
yes,
recording.
yes. Sorry. So if I'm doubling up on what I'm saying, I'm really sorry. But unfortunately, nobody in the group has used the document yet. So we only got so far with our conversations. But there were a couple in the room that have read it and they're about to start using it. So we were really just talking about just diving in, having a go. A couple in the group were saying that they were quite sort of excited about the fact that there's lots of links on there, lots of signposting resources that you can tap into and use. So that looked really good. It was user friendly. So really we were just talking about the fact that you might just want to pilot with a couple of little children, because there's sections that you might want to use. You might not want to feel overwhelmed by the fact that you have to use all of the documents. There might just be little areas and so on, but we only got so far because no one's actually had a go at using it yet. So that was really what we were talking about. So I don't know if there was anybody in my group that wanted to add anything extra. I think that was probably everything. Nope.
That's why it's useful to join together sometimes as well, isn't it? Because it gives us the opportunity to remind us what we need to be looking at. And we've been all working in such isolation, I think, over the last year, working in our own bubbles, if you like. Don't really want to use the word bubbles, but we have. So it's really nice to hear from all 5 groups about the different spectrums of where people are. And it's a good reminder for those that haven't quite yet managed to use it that, like you said, they can have a go at piloting it, which is a great way to start using it. And I think that's the best way to become familiar with it, isn't it? Is to actually start using it in practice and take it a chunk at a time. Like Suzanne said, it's a big document, so a chunk at a time is a manageable way to do it.
Yeah, and I know in our group we had a new SENCO that's only been in row for a month or so. So she was saying, she's come along today really just to sort of hear messages and get some tips and advice really on how to go about using it. So this is still really a valuable conversation from joining in. So thank you.
And it's certainly one that we might be able to revisit further down the line. I'm not saying, in the next term's SENCO briefing, but maybe in 6 months' time or a year's time, and come back to it and see how well embedded it is a year on from now. Okay, I'm just going to share some slides again. I'm going to just have a quick overview of where we are in terms of the EYFS reforms. So I'm not going to go into any great detail about this because we have provided some training around those EYFS reforms. I think it was only last week actually for early years settings. So if you haven't attended, if you didn't manage to attend that, but would like to hear an hour and a half about those reforms, please look at the recent early years bulletin because it's got the links on it to our training page. And on there, you will find a recording of that information session where it will go into way more detail than I'm going to touch on in the next minute or two. We were lucky enough last time as well to have a little insight and overview from Mel about those reforms. So we've got a little bit of knowledge behind us already. But I just wanted to pick up on some of the messages around assessment because one of the aims of the reforms is to reduce the burden of paperwork for early years practitioners so that you can spend more time interacting with the children. And I think from a SENCO perspective, that is so important. The more time that we can spend with our children, playing with them and learning from what they're doing with us alongside them, the better and the more insightful. So in front of you, we've got a couple of messages coming up in chat, so I'll look at those in a minute and come back to those towards the end. So thank you. Do please continue to put those messages into chat and those questions. So in terms of assessment, on the screen there, you've got some bullet points that come from Development Matters, page 6 to 7. And it's within the Working with the Revised EYFS Principles into Practice by Julian Grenier, who you'll hear lots about when you listen to that recording. So I'm just going to read them out to you first of all, just to give us the context. So assessment is about noticing what children can do and what they know. It's not about lots of data and evidence. Effective assessment requires teachers, practitioners to understand child development. That really underpins our work with all children, doesn't it? But particularly with our SEN children, when we're identifying that there might be some barriers for them. Practitioners also need to be clear about what they want children to know and be able to do. Accurate assessment can highlight whether a child has a special educational need and needs extra help. So I'm really pulling out that statement in particular for us this afternoon. Before assessing children, it's a really good idea to think about whether the assessments will be useful. An assessment should not take practitioners away from the children for those long periods of time. So the reason I'm just starting with that is that, you know, for some children, we do need to drill down into a lot more detail, partly because we need to work out what the barriers for that child are and to plan effectively. And we've got lots and lots of tools that help us to do that. But when we're using those tools, we need to be keeping those statements in mind. What's the purpose of the assessment that we're doing and how's it going to help us? It needs to be purposeful to help us to take that child forward. And we know that sometimes we need to provide that evidence for SEND professionals. So as Penny was talking about earlier, we don't want it to be burdensome, but we do need sometimes to have that really clear assessment so that when a child goes to seek some extra support from a SEND professional, we can see what that child needs. So it helps us really to drill down and give more detail. So I'm going to really quickly, and I know we've talked about this in previous briefings, and this comes through in your graduated approach anyway, just really quickly outline or list really the tools that you might be using. So the first one in front of you obviously is observation, assessment and planning, which is your whole OAP system. And you as a SENCO with the revised reforms are going to be really key in those discussions around what your OAP systems are going to look like. For some reason, my screen's just clicked onto something completely different, hasn't it? So excuse me a minute. There we are. Can you all see that now?
Yes, we can.
Yes, brilliant. I don't know why it did that, but there you go. That's computers for you. Summative assessments are really important, and any other assessments. And we're talking about, you know, particularly at times for those summatives when children are transitioning in those significant moments. Development matters, of course. We need to seek those parent and carer views. Taking any information from parents, you know, we know that parents know their children best. They'll have been with them since birth, and they're going to have all that information that they need to share with you. Chronologies of significant events. We still refer back to our early years developmental journal, which breaks things down into really nice steps when we're thinking about how important child development is in underpinning everything. And our ages and stages questionnaires, and I know a lot of you support parents in completing those to then share with the health visitors. Speech and language assessments and next steps. Any reports, medical reports, so that could be from a paediatrician, could be from an occupational therapist or a physiotherapist. So any of those reports and letters will aid your assessment. And of course, the Plymouth Graduated Approach to Inclusion, which we've talked about this afternoon, and thinking about any documents around that outcome-based planning as well. What does that tell us? What do we do with it next? Child development resources, we're often flagging up the book from Carolyn Meggett. That's really useful when you're not quite sure where a child is and you want to delve a bit deeper. And then the other resources that we're always talking about as well, the play skills checklist, this is all in your graduated approach, first words checklist, blank levels, concept lists, the list goes on. If you've done Elkland training, things like information carrying words, that link between play and language and attention skills, and information from the Autism Education Trust and the Communication Trust Toolkit, and of course the Every Child a Talker child monitoring tool that most of you will have, hopefully. And just to say that is being reviewed in line with the new ERFS, and as soon as we have any updates on that, we'll let you know. Then if we're thinking particularly about children's behaviour, that iceberg theory, thinking about what's actually happening behind that child's behaviour, so using our star charts and any other behaviour reporting systems that you might be using. And then we've just popped in the bottom, so I know we've talked about it before, the importance of your gut feeling, really, your thoughts and feelings from your own observations. So really quick overview there, because we've had lots of discussion, but up on your screen now, you've just got a few prompts there. We didn't mention Ferry Lavers, of course, a really good tool for measuring children's wellbeing and involvement. You've got your early years developmental journal, universally speaking from the community trust, communication trust, and also your language builders. You know, always refer back to those tools that you've traditionally been using for a long time. I'm just popping up on a slide there, and you will get these slides, an information session or resources that have just recently come through, which we flag up on our EYFS reforms training, all about the reforms. So please do go and research a little bit further. So that's there for you. So without further ado, I'm talking very quickly because I know Mel's got some things to share with you. I'm going to pass over to Mel now with some updates around some CPD opportunities.
Jenny, you've got a couple of questions in the chat. Do you want to look at those now around the graduated approach?
Yeah, okay, let's have a look at those. So we've got Sam Beale. Is that the first one, Suzanne?
Yeah.
Yeah. In our group, we were concerned that the document would become a prerequisite for referral. In a time where there seems to be a shift towards trusting professional judgments, it's worrying to see an enormous checklist when you open the link. Yes, I think it can be daunting, but I guess it's looking back at that assessment, you know, what are they going to ask for? I don't exactly know what's going to be requested in terms of referrals. I don't know whether any of my colleagues have got the heads up on that, but it is there as a tool that you wouldn't, I presume, necessarily use the whole resource to be requesting support. It would be using it to guide your application.
Jenny, can I just interject? If you look at the access form on the guidance, it talks about the Plymouth graduated approach, and then has so supporting documentation. So it talks about it, but it also says MASP. What I think people will be wanting is you will need to show us your setting, and that then comes on to Tara's comment afterwards, is that you need to show us the setting. So what have you done? What have you tried a little bit of? There will be children where they just land into the setting and you think, oh my goodness, that child's got significant difficulties. We need to actually seek advice straight away. And I think for you, Tara, your question was, what do practitioners do when there's obvious need for extra help? You basically ring up and you say, can I talk to somebody? What advice can they give me? Because you're seeking advice, and we can give you some general advice. And then obviously we'd minute that, and then we'd say, well, perhaps you need to make that request into the access early help through that request for help form, and then you would be allocated hopefully a service. So I hope that sort of answers both. But Tara, I didn't understand what you meant by APDR process. Sorry.
Assess, plan, do, review.
I think obviously if you have a child who comes in and it's very obvious, then you'll probably need to, and it also depends on the child's birth date as well, doesn't it? Whether you can try a few little things, so like you would do with a code of practice. I'll try a few things, what can the child learn? But obviously if their needs are, you know, 0 to 11 and the child is 3.5, then I think I'd be advising you to seek help from outside agencies. Does that answer questions or not?
Yes, thank you.
Yeah, it was just from the practitioner's point of view that there, you know, sometimes things are very obvious. Yeah. And to go through a you know, quite a formulaic process that could take a long time when early intervention is key. You know, rather to get as much early intervention as possible, as opposed to, you know, 12 months too late intervention. I can see where the practitioners would be getting quite would perhaps get a little bit concerned about that. But that helps enormously if they've got someone to ring. Who would they ring? Just, I mean, I'm coming from a parent
to be honest,
so I don't know.
Yeah, I mean, Tara, they could ring Access Early Help.
Okay.
They could ring Gateway. They would probably put us through to someone either like Jane or myself, or sometimes Penny, or somebody to give some, you know, anybody really. I think that would be the best way that they, and obviously sometimes we're in the setting already, and practitioners will know that from Jane and myself, I sometimes go into a setting and say, so what have you done about that one? Or what have you done for that one? Please refer in. And Jane and I are having planning meetings with certain settings where they have a large number of children. And we do say, please refer into the early years intake meeting. We may not need to know the child's name. We just need to know that actually, you know, they've got a child A or child B or child C. And we can give some advice, general advice. And I know that Jenny, also with your team as well, sometimes you get calls in and you direct them to us sometimes as well, don't we? Or we do joint things.
Yes, that's right. Yeah.
So I would say if they're at all concerned, please phone in. Would you agree, Jane?
Yeah, and it's not a prerequisite at all,
No.
but I think just to summarize it, once you start to fill in the form, you'll know if you already know that things are going to work or not going to work, or they've already been tried in the past at home. So yeah, it will just add to the quality. But as we were saying, if you've already got that good practice, if you've been a SENCO for a long time, if you've already been on lots of SENCO training, you are probably already doing those things anyway. So it isn't a tick list,
No.
but I can see how it would look like that.
And it's
But
always daunting, isn't it, when there's lots of
sorry.
pages?
Sorry,
Was
that's
that-
quite reassuring what Jane just said. Was it Jane? Because
Yes.
that's what I was worried about, because I must admit, I have opened it up loads and loads of times, and I always look at it, panic, and think, I'm so busy, I can't even begin with this. So my point was really that I'm happy to use it as an extra tool, because obviously I think anything that gives you ages and stages and guidance is a good thing. But I want to use it on my terms rather than it becoming something that I have to fulfill in order to go to the next stage of getting help for a child. Because some of it is useful, some of it obviously for each child isn't. Some of it is, you know, you just think, oh, you know, that's stuff I'm doing already. So I wanted it to be like, it's a tool for me rather than a tool for someone to check up on me and see that I'm doing what I should be doing. I don't know if that makes sense.
Yeah, no, it does. And I think it is a tool that you can use as a professional development tool. Like I said earlier, you may have not had a child and you may be looking at a specific area that you haven't had many children with difficulties in that area. And then it will make sure that your referral is good quality, won't it? Because you'll be thinking, actually, we'll look at that section. Oh, gosh, I hadn't thought about that. That's obvious. But actually these people looking at the paperwork they don't know the child, so they will need to know this. Do you see does that make sense?
No,
Yeah.
I do know. And obviously it's just it's just the, you know, as a tool, I want it to be of use to me rather than, as I said, it's sort of like something that this shows that I've done this and this and this, because some things you've already done them. You've done them like ages ago.
Yeah, but of course we've got to remember some people are new to the role, aren't they? And they haven't done the outclan training and they haven't done all those things. And there are probably some people sat here today looking at your presentation, Jenny, thinking, gosh, what does that even mean? Because, you know, a lot of these training packages did happen quite a few years ago, didn't they? So it's only some of us older people that have been through some of the training.
Thank you, Jane. I just had to put myself on mute because my home telephone just started making a noise even though the door was shut. So hopefully you didn't hear that. Okay, I'm going to pass over to Mel now, who's going to just give us a little overview of some CPD opportunities.
Yes, well, the first slide is more around a resource to support you. So I think at one of the previous meetings, I mentioned the Let's Get Chatting campaign. And I mentioned that there was some releases via social media with some key messages around supporting children's communication and language. But we thought we'd take this opportunity this afternoon to just draw attention to the Padlets that are available. So you'll see the links there. And I'm going to try and share my screen now just to show you what's available on those links. So just give me a moment. And hopefully, can somebody just say, yes, I can see the Padlet now?
Yes.
Yeah, so if you click on one of those links, this is what it brings you to. And these have been designed for you to share when you're having conversations with families about a particular child's communication and language. And you'll notice there's a little sliding tool here, and it takes you to lots of really useful resources that you can reference parents to. So if we just go through this one, so key things to do to support your child. And there are some nice little video clips. So if you were to click on that one, it would show you a video clip of effective adult interactions for 3 and 4-year-olds. And then reference to things like Hungry Little Minds. So all of the resources to support communication and language are in one place so that you can share them with parents. It's like a menu or a library of useful links and resources. So that was one thing we wanted to draw your attention to. Just going to try and come back now, stop sharing my screen. Okay, so Jenny, have we got the PowerPoint again, please? Just out of interest, has anybody already used those Padlets or looked at the social media campaign and started posting those for yourselves? Can't see any hands up. No. Oh, yes, there's somebody with a hand up there. It's Sarah from Children's Centre.
Yeah, this is
Sarah,
the Children's Centre. We've shared it far and wide, which has been fantastic. So, and we've used it within our one-to-ones with families. It's just like a little extra thing to pass on information.
Thank you. Are you talking about the Padlet, Sarah?
The Hungry Little Minds information.
Brilliant. Thank you.
Yeah.
So if you want to look at the Let's Get Chatting, they're sort of like virtual posters, really. If you go onto the Devon Preschool Speech and Language Therapy Facebook page, each day there's a key message about communication and language, part of the Let's Get Chatting campaign, and you can share those messages via your own social media if you want to. So, for example, I'll just share my screen again. This is an example of one of those social media posts. So a key message every day. So that one's relevant to 3 and 5-year-olds. And the other one, if you notice, there's a QR code there. So if a parent were to scan that QR code, it takes you to the link that I've just shared with you. So a wealth of resources there that I would recommend you have a look at and share with your families. Okay. And then if we go on to the next slide, please, Jenny. Thank you. So a letter was sent out to early year settings from Live Well Speech and Language Service, but just in case anybody missed that letter, we've been asked to just flag up the fact that that there's a free training office from the Children's Speech and Language Service. So this is sort of a list of everything that they're offering in terms of CPD to support you and your staff to deliver high quality support for communication and language. So there's a list of CPD that's available there. And if you want to book on any of that, there's a number at the bottom. And I believe there's some BLAST training happening today. So I don't know if anybody's already booked onto that. And there's Top Tips training happening on the 30th of June. And then on the 6th of July, there's a session on speech and cued articulation. So if you want to book on any of the training, then just give them a call. And there's lots available to support your universal provision. And then, of course, if cued universal provision's in place and you still need to make a request for support, then you would do that too through Live Well. And then finally, the other thing to draw attention to, if we have the next slide, please, Jenny. this is just a bit of a heads up of what's to come in September. So you may have already heard talk of the ELIM assessment. So that stands for Early Language Identification Measure. And this is an assessment that the health visitors are starting to roll out with 2 to 2.5-year-olds all around speech, language and communication. So the health visitors are in the process of being trained in Plymouth at the moment. Some will start using the ELIM assessment in July. Everybody will be doing it by September. So it's an assessment that's carried out by health visitors, and it looks specifically at children's use of vocabulary, but also at their interactions and the interactions of their parents. And if they score lower than, I believe it's 17, then that can trigger some support, some intervention work that either the health visitors or children's centres workers will be delivering. And that support sort of tailored towards supporting the family. So it really focuses on effective adult-child interactions and key messages around that. So some tailored intervention work will be triggered via the ELIM assessment. But the reason that we're alerting you to it is that if there's a child in your setting who is identified as needing the intervention, then the health visitor is likely to be in touch with you to let you know that that's what's happening. And then there'll be a discussion about the work that that child's key worker can do in the setting to complement that intervention. So we'll be holding an information session in September to give you lots more information about this and to sort of expand on the role of settings and how we can work together with health colleagues to really put that support in place early on. Okay, Jenny, thank you. That's all I wanted to say.
Thank you, Mel. You'll find that when we send out the slides with the bulletin, there's lots of slides that I'm not going to show you now, but you can refer to, that are all different CPD opportunities from NASON, who are, of course, mentioned in our graduated approach. So there's lots of webcasts, etc., that are advertised through that, but I'm not going to take you through all of those now, because I think you've been listening for a long time. Just to flag up that I did have an email at the beginning of the week from our rep from NASON, who'd said that accidentally the Zoom links had been sent out for the Meeting the Needs of Every Child training. So if you went on that, you might not have been sent the handouts. So in this week's bulletin, ready for the next 2 dates, which are the 29th of July and the 1st of August, or 12th of August, I'll make sure that the registration email comes out via the bulletin, so please book in that way, otherwise you won't be sent the handouts. They just realised at one of the events that nobody had the handouts, so a little bit of a blooper there. Okay, so I don't want to talk anymore. I just want to see if anybody else has any gems that they've found in terms of CPD, or any links that you found on any websites that you think would be really useful to flag up to us all in this forum this afternoon. So maybe if you pop your hand up, or you could try calling out, and we'll hope that not too many people call out at once, but we'd love to hear from you now. Unless we've worn you all out this afternoon in our discussions. Anybody found anything really useful? Perhaps even something we've mentioned already today, and that's fine. Oh, I can hear somebody. Perhaps if you do think of something and you don't want to share it in the wider forum, if you could let us know, we can look into it and then perhaps share ideas via our normal route of the e-bulletin. I'm just going to carry on talking a minute, just in case anybody does pop their hand up, because we do like hearing from you who are down, doing the job and have so much expertise to share. Before we do finish, just in anticipation that somebody might pop their hand up, we haven't set a date yet for the autumn term, but we will be doing so either towards the end of this term or it will be early in the autumn. So we will communicate that with you. We just haven't as yet set a date. Okay, I've just got a message in the chat. Thank you, Sarah. She said, I felt it was good just to catch up in a breakout room We discussed how things had gone during these ever-changing times. That's really good feedback. Thank you, Sarah. And I don't know whether, and we always like to hear what you would like these SENCO briefings to involve. And thank you to, it was Sam actually. Thank you, Sam, for suggesting that we thought about CPD. What we do want to do is make sure you do have those opportunities to just have an open discussion. It might be that you suggest we don't actually want an agenda, we just want to come and talk for half an hour about our SENCO role and how it's going. And that would be fine. We would build that into the next briefing or the one after that if need be. So that's useful to hear. Thank you, Sarah. Any other feedback? Oh, Sarah, can I come to you?
Yeah, it's just a really quick one. I'm Sarah from Action for Children, Manor Street and Green Arc Children's Centres. I'm sure you're absolutely all aware, but just to say that the children's centres are back doing step-by-step groups. So they are all being done in a different way depending on where your family are located in the city. But obviously with step-by-step, if a family have got transport or are happy to get the bus, they can access any step-by-step session. So I think the best thing to do probably is to signpost families to either Bernardo's, Action for Children or Lark's Facebooks, where it will have up-to-date information about what we're offering. And I know as a children's centre, we're hoping to get our summer holiday programme out to all of our early years networks over the next couple of weeks, because everybody's doing lots of different things over the summer. So yeah, just to share that really.
Thank you, Sarah. That's really useful to hear. Thank you. Well, if nobody else has got anything to pop into chat, or if you want to share something another time, that's fine. I'd just like to end by saying thank you for your participation this afternoon. And as Penny said at the beginning, I kind of want to play it back again, and if I could, I would. You're all doing such a fantastic job in such difficult times. And we really, from our end, would like to say thank you. And if we don't see you before the end of term, I know not everybody gets a break, but I hope you all get some kind of break. Thank you for your sterling efforts through the last academic year. And don't forget, we're here if you need us at any point. So have a little rest. Hopefully some of you will get a long rest, but take care of yourselves and thank all your staff for all they're doing. Okay, take care.